Sodapop, a tool for selecting antimicrobials for targeted therapy. The objectives of today's session are to learn what Sodapop is and what each part of the process entails. We will also practice applying Sodapop in a clinical scenario. Sodapop is a mnemonic device that incorporates the most important of multiple factors that should be considered when interpreting a culture and sensitivity report and selecting an antimicrobial for targeted therapy of bacterial disease. Sodapop may not include every single factor that should be considered when selecting an antimicrobial. For example, it does not consider cost. However, Sodapop does include the important factors when deciding what would be the most appropriate antimicrobial to choose with regards to antimicrobial stewardship. Sodapop stands for source, organism, decide to treat, antimicrobials, patient, options, plan. When selecting an antimicrobial using the Sodapop method, the first thing we must consider is the source. Several key points are important to consider with regards to the source. First, we should consider whether an appropriate source was used when collecting the sample for the suspected disease. For example, for superficial bacterial folliculitis or pyoderma, the most optimal sample would be collected from a ruptured pustule. For suspected urinary tract infection, urine can be collected using cystocentesis. For suspected lower respiratory tract disease or pneumonia, several methods including endotracheal wash, transtracheal wash, or bronchoalveolar lavage can be used depending on what the suspected distribution of the disease is. We should also consider the likelihood of contamination from the source. For example, the skin in the perianal region is more likely to be contaminated than skin along the dorsum of the dog. Free catch urine, especially in female dogs, is difficult to obtain and may be a likely source of contamination if submitted for culture. The upper respiratory tract of animals typically contains many commensal organisms and likely contaminants. Nasal swabs must be interpreted with extreme caution if submitted for aerobic culture and sensitivity. Next, we will consider the organism or organisms that were isolated and identified on the bacterial culture and sensitivity results. One important factor to consider is whether or not an agent that is common for the disease process was isolated. For pyoderma, Staphylococcus pseudointermedius and Staphylococcus schleiferi are the most common agents. Staphylococcus aureus can occasionally cause this disease as well. Some organisms, like Pseudomonas aeruginosa, may also cause disease in the skin. For urinary tract infections, E. coli is the most common cause for both dogs and cats. Gram-positive agents of urinary tract infection include Staphylococcus pseudointermedius and Enterococcus species. Other enteric organisms, such as Proteus and Klebsiella, may also cause ascending urinary tract infections. A variety of other organisms have been reported to cause urinary tract infection in companion animals. In determining whether or not this organism is relevant for the disease, it should be considered whether or not a common agent was also isolated, the likelihood of contamination, and the quantitative results of the organisms within the urinary tract culture. For pneumonia, Bordetella bronchoseptica is the most common cause of community-acquired bacterial pneumonia. Streptococcus equi subspecies Zooepidemicus has received significant attention lately as another agent of community-acquired pneumonia. Pasteurella maltosida is often considered a common secondary bacterial pathogen that causes pneumonia. And a variety of enteric organisms, such as E. coli and Enterococcus, may lead to pneumonia after an aspiration event. On your culture and sensitivity report, it is not uncommon to have an unexpected or contaminant organism isolated. Common contaminant organisms include coagulase-negative Staphylococci, Neisseria species, Bacillus species, Micrococcus species, Corynebacterium species, and fungal organisms. It is important to note that many opportunistic pathogens can also be contaminants. For example, Enterococcus or E. coli, when isolated from the skin, may not cause disease. When considering the clinical relevance of an organism, the results of histopathology and cytology can also be used. Next, you will decide whether or not to treat your patient based on the organism and source information you have gathered. You should only treat if the organism is a potential pathogen or agent of disease from the source of the specimen that you submitted. Next, list all of the antimicrobials to which the organism that you've decided to treat is susceptible. It is also useful at this point to identify any lowest tier antimicrobials that can be used to treat this infection. The International Society for Companion Animal Infectious Disease has put out guidelines on which antibiotics should be considered the lowest tier. For skin, recommendations include clindamycin, TMS, amoxicillin clavulanic acid, cephalexin, and third-generation cephalosporin labeled for staphylococcal pyoderma. For urinary tract infections, amoxicillin and TMS are considered first line. And for respiratory tract infections, doxycycline, amoxicillin clavulanic acid are considered first line depending on the disease process suspected. Fluoroquinolones may also be considered first line, especially in the case of potential life-threatening disease. After making our list of antimicrobials, we must now compare those antimicrobials to our patient. We need to determine if any of the antimicrobials are contraindicated in the patient based on species, breed, age, or any pre-existing conditions. For species, a good example is doxycycline tablets in cats, which can cause esophageal stricture. For breeds, sulfonamides are contraindicated in black and tan breeds, such as Dobermans, because they are at an increased risk for immune-mediated disease. In young animals, fluoroquinolones and tetracyclines are often thought to be contraindicated. Fluoroquinolones can affect cartilage development, and tetracyclines can cause enamel hypoplasia. For pre-existing conditions, a history of a beta-lactam hypersensitivity would contraindicate the use of any beta-lactams in that animal. Or a history of immune-mediated disease may mean that the clinician wants to avoid drugs such as the potentiated sulfonamides. We also need to determine if any antimicrobials are not effective at the site of the infection. For example, clindamycin cannot be used in the urinary tract. Cefovicin and nitrofurans don't have good penetration in the upper respiratory tract, and other antibiotics are considered much more effective. And nitrofurans also don't have any penetration to the skin, as they only concentrate in the urinary tract. Now that we have eliminated any antimicrobials that are contraindicated in our patient, we will list the remaining antimicrobials, with our lowest tier antimicrobial options first. Then we should also include any other options that we have. These may include non-systemic therapy options, such as topical therapies like shampoos and disinfectants for pyoderma, local therapy such as antibiotic containing beads for joint infections, and considering if the disease may be self-limiting on its own. This might include something like abscess resolving after establishing drainage, or uncomplicated kennel cough. Once we have all our options out on the table, we should choose our lowest tier systemic antimicrobial or non-systemic therapy option that best suits the patient. Once we've selected our approach to treatment, we will need to put together our plan. The plan should include the dose, route, frequency, and duration of therapy. But it should also include factors such as how the client and vet will evaluate successful treatment. Will it be through resolution of clinical signs, by reculture, or radiographic improvement? It is also important for us to address any underlying diseases that predispose to these infections, or else our patients will continue to get these infections. Those underlying diseases might include for skin, food, environmental, or ectoparasite allergies, urinary tract infections. It might include anatomic abnormalities or endocrinopathies. For respiratory tract infections, it may be important to determine whether or not an underlying immunosuppression exists, or if there's been some sort of break in the vaccination status of our patient. Let's review Sodapop again. S stands for source, O, organism, D, decide to treat, which you do based on the correspondence of an organism that is likely to cause disease at the source. A stands for the antimicrobials that the organism is susceptible to. Don't forget to identify your first-line antimicrobials at this point. P is for patient. You are looking for any antimicrobials that are contraindicated in the patient. O is for options. Don't forget systemic antimicrobial and other options should be explored. And finally, P stands for plan, which not only includes dose, frequency, and route, but other factors such as treating underlying disease. So now let's do a case example and apply Sodapop to that case. Itchy is a 5-year-old male castrated Doberman Pinscher with chronic skin disease. The most recent course of antimicrobials did not yield any improvement in clinical signs. So you've decided to perform a skin culture. So using Sodapop, let's identify the source. The source is multiple intact dermal pustules. This is a great source for testing for the agent pyoderma. The organism is methicillin-resistant Staphylococcus pseudointermedius. As we previously mentioned, Staphylococcus pseudointermedius is the most common cause of canine pyoderma and is most likely a pathogen in this scenario. D, decide to treat. Yes, because the pathogen matches the source. We now list the antimicrobials that this organism is sensitive to. These include amikacin, chloramphenicol, trimethoprim sulfamethoxazole, or TMS, and vancomycin. We want to identify any first-line antimicrobials now that might be within that list. TMS is considered a first-line antimicrobial for canine pyoderma. At this point, we'll also eliminate vancomycin, which is not a veterinary drug and a critical drug for human medicine, and amikacin, which only exists in an injectable formulation and has a high risk for nephrotoxicity. We will leave chloramphenicol on the list as an alternative option to TMS. For patient, we will consider the contraindications for each of these drugs. Chloramphenicol is contraindicated in dogs with liver disease. Since Itchy has no history of liver disease, we'll consider using chloramphenicol. Don't forget, TMS was one of our first-line antimicrobials and would be our choice as long as it's not contraindicated in Itchy. However, TMS is contraindicated in dogs with histories of autoimmune disease, as well as dogs of the black and tan breeds, like Doberman Pinschers, but also Samoyeds and miniature Schnauzers. Since Itchy is a Doberman Pinscher, we are going to cross TMS off of our list. So at this point, we're going to list all of our options. Right now, our only systemic antimicrobial option that we are considering is chloramphenicol. But on top of that, we have other options since this is skin disease. We could consider topical therapy, chlorhexidine, benzoyl peroxide, or dilute bleach baths might be an option. Ultimately, we decide to go with chloramphenicol as a systemic antimicrobial treatment. There are a variety of reasons you may forego or combine this with topical therapy. For our plan with chloramphenicol, we're going to use 50 mg per kg by mouth 3 times a day for a minimum of 3 weeks. On top of that, since chloramphenicol can cause bone marrow suppression, we're going to get a baseline CBC in order to monitor for that. We also are going to address the underlying food allergy with a strict diet in this case. And finally, we're going to monitor for resolution of clinical signs and describe the timeline progression to the client. In conclusion, Sodapop is a tool that students and practitioners may find helpful when interpreting a culture and sensitivity report and selecting an antimicrobial drug for targeted therapy. Thank you for participating in a study to evaluate the utility of Sodapop.